Hi, I'm Dr. Sujata. In this video, I'll be talking about types and risk factors of cataract. We'll be talking about different types of cataracts. The first type of cataract, which is very common, is a nuclear cataract. It starts around the age of 60 to 65. People who had problems having difficulty in reading near visions will suddenly start seeing better, or what we classically call as second sight. That is, first you are not able to see near vision. Now with the glasses you are seeing. Now suddenly you can remove the glass and you can see your paper much clearly. So this usually starts at the center of the lens, that is a nucleus. It becomes hardened and it becomes yellow in color. Patients start having colored halos around bright light, especially in the night. The second type of cataract is the cortical cataract. These cataracts take shape on the outside edge of the lens called the cortex. The main symptom of this cataract is glare in the night. So while you are driving, you will not be seeing things clearly. And this also produces difficulty in distance and near vision. So the best thing is, if you have a cortical cataract, is to get operated as early as possible. Now coming to posterior subcapsular cataract, we have a lens capsule that surrounds the lens, and this capsule holds the lens in its place. This cataract, posterior subcapsular cataract, is formed just inside the back of the lens capsule. These cataracts are present directly in the path of light and it passes through the lens. These cataracts come quicker than others and you might start experiencing symptoms within months. These affect your close-up vision as well as it makes it harder to see in bright light. You will start finding it difficult for reading, then there will be glare, there will be halos around the lights. Now we will be talking about congenital cataract. So what is congenital cataract? Congenital cataracts are cataracts that one is born with or one you acquire when you are a child. They may be a result of some metabolic disorder, or it may be due to some illness the mother had in the first trimester of pregnancy, like rubella infection or torch infection, which is commonly known as. Some of them require treatment, some don't. So the ones that require treatment are if they are in the center of the lens or the vision is blocked and the child doesn't develop fixation of the eye. That is the one which requires treatment. So remember, all congenital cataracts doesn't need treatment. If the one that blocks the vision, it requires treatment. So it's best to consult an ophthalmologist and then seek for the treatment. Now coming to traumatic cataracts, many kinds of injuries can cause cataracts. Some may be small, as trivial as a fist injury, tennis ball hitting the eye, or if there is any chemical burns, all that can produce traumatic cataracts. What is the difference between the traumatic cataract and other senile cataract? This develops immediately after the injury. So anything, if you have an eye injury, it is advised that you see a ophthalmologist. Now coming to complicated cataract, these are cataracts that are due to some medical condition, or you are taking some medication and you have developed these cataracts. Diabetes, very common disease in India. It produces diabetic cataract. Then steroids like a prednisolone or any over the counter, you get drops and you use it regularly, you can develop cataract. Yeah, now we will be talking about other rare types of cataract which are heat cataract, irradiation cataracts. Heat cataracts are usually seen in people who work in glass industry, also known as glass workers cataract, for a long time. Then irradiation cataract is seen in technicians who are exposed to X-rays, gamma rays and neutrons, and also people treated for malignancy in and around the eye. There are few other types of cataracts. There are lamellar cataracts, posterior polar cataracts, anterior polar cataracts, Christmas tree cataracts, Brunnesen cataracts, diabetic snowflake cataracts. Now I will be discussing about the risk factors for cataract. The single most risk factor for developing cataract is age. So as you age, you will develop cataract. Now other modified risk factors are use of steroids. If you go on using steroid medication, there is high chance of developing cataract. Then any eye injury, diabetes, then drinking, smoking, and any exposure like any x-rays, or if you have taken any cancer treatment in and around eye area, you will develop cataract. Now coming to the treatment of cataract, there is no medical treatment for cataract. Surgery is the only way you can treat the cataract. And when should you go for surgery? When it starts interfering with your daily activities. Medfin can be your best partner when going for an eye examination, finding you a right doctor, or getting a cataract surgery done. To know more about cataract, please click the link in the description box.